Ballad Health's Health Resources Center now has a new name, Community Health Resources. The new name fits the new outreach strategy, which brings health and wellness classes out into our local communities. Here with us today are Casey Carringer, and Director of Clinical Engagement for Ballad Health, and Crystal Rush, Outreach Partner for Community Health Resources. Thank y'all for being here today.
Thank you.
Let's talk about this new initiative, this new strategy. Tell us about it.
Yeah, so we really just wanted to look into an opportunity to better serve the people of the Appalachian Highland region. And so we really are working to meet folks where they are. And so this is a mobile strategy that can really take those classes and education to the community.
Talk to us about some of those classes, some of those offerings that y'all are going to have.
We have a large variety of classes, everything from diabetes, pre-diabetes, chronic management of chronic conditions. We have a smoking cessation class that we offer, blood pressure, stress management, so a wide variety of classes.
Now, taking all of that into account, I mean, a lot of these are life skills. I mean, these are truly life skills, and there is a definite need for these classes, isn't there?
There is a need, and having not the center as we've had for 20+ years, we're getting out into the community, reaching those folks who maybe haven't had the opportunity to come to that center. So we're hoping to reach a lot of those in the rural areas.
So you're kind of flipping the script here. Yeah. Instead of folks coming to you, you're going to them.
Absolutely.
Did you find that was a definite need in the community?
Definitely. We've had a lot of agencies reach out in the rural communities, and with the with the travel and everyone's so busy nowadays, it was just an opportunity for us to really meet folks where they are and respond to the need. And so we are very excited for this opportunity.
Now let's say that someone's out there right now listening and they want to say, well, I'd love to take some of these classes. How do they get involved?
Sure. So they can email Crystal.
Yes.
You would love to have those emails.
I would love to have those emails. Yes, we will still offer things at our center. We are still going to have location and a classroom so folks can come in. And we will have a nurse that will be able to meet those needs at the center. So that still is a possibility.
Typically, let's break it down. When you go out to, let's say you go out and you're teaching a class out somewhere, is that you have fewer people there, or do you have more people that come to the centers to do these classes?
As far as the educators?
Yes.
Well, we can partner with community agencies who have existing educators, and really we respond to the need. So if an agency says, hey, we can discuss this topic, but maybe can you supplement with your resources, we can certainly do that. So.
And when you go out, talk us through this process a little bit when these classes take place. I mean, is it a classroom situation, or is it more hands-on? Talk us through the process of this.
It really depends on what the agency needs. We have classes that are as hands-on as crock-pot cooking lessons. So
I'm sure Amy, if she was here, would love that. Yeah.
So nutritionally, how do you provide or cook nutritional meals for the crock-pot? We have classes that are very much more facilitated, so group discussion. So really, there's several levels of interaction, just depending on what the need is. We're very flexible.
Are you surprised at the amount of need for these classes?
Yeah, we are surprised. Especially in this area, diabetes is a huge thing. There is definitely a need for the diabetes education, so that is one of the things that we focus a lot on. So we're very excited to see the folks that we can reach once we get out of the...
When an agency contacts you and wants to bring you out to do something, when you get there, do you get a lot of response? I mean, do you get a lot of feedback from these folks saying, thank you for being here? I mean, what's the response?
Oh, absolutely. Absolutely lots of response, because a lot of times people don't have, I mean, we're free. We're a free entity, so that is helpful for a lot of folks who maybe don't have resources to see a doctor every time they have a question, or so we are very helpful, and they are very grateful. And
for nonprofits, this is a win-win. I mean, you're bringing folks in, and it doesn't cost them anything, but they're getting the information that they need.
Absolutely, yes.
Do you deal with a lot of nonprofits, or is it more churches? What do you deal with?
I would say it's a fair combination of both, but definitely a lot of community-based organizations. And some employers have reached out too and said, we would like for you to engage with our employees, whether it's a lunch and learn session. Really, just like I said, we are very versatile and can be on the road and go where you need. So.
I want to ask both of you, what's your favorite part of this whole situation when you go out? I mean, what's the thing that makes you get up in the morning and say, hey, I'm ready to go do this?
To know that you've helped somebody.
Yeah.
That's a really rewarding feeling, to know that you've made a difference
All right.
in their life.
Ladies, thank you all so much.
Thank you so much.
Folks, we got some information for you right here on the screen. It is Community Health Resources. To schedule a class, she wants to see those emails start rolling in here today. Give her an email right there and take advantage of all of this free information.